Hi, I'm Mark Sampati from the Cryo Sports Treatment Clinic. I'm looking a bit hot and sweaty because I've just been out playing basketball with my son Dominic. I just want to tell you a little bit about Sever's disease. Sever's disease is a condition rather than a disease itself that is quite common in adolescents, particularly those that are really active and playing lots and lots of sport. It's a condition where the growth plate at the heel, where the Achilles attaches, basically gets lots of stress put on it and then starts to break down. On the muscle chart here you can see the calf muscle, and then you can also see the Achilles tendon coming down to attach into the heel bone, or the calcaneus. This is where there's a growth plate, and it's basically lots of activity within the calf pulling repeatedly on the heel bone that puts pressure on the bone, and the bone's getting pulled away and it tries to stick itself back down by creating extra calcium around the bone. Now, it can be painful and it can really limit the child's ability to run and jump and participate in sport. It is something that just takes a reasonable amount of time, 1 to 2 years to resolve. So this is my son Dominic. Dominic's going to show us the stretches that he had to do when he had Sever's disease a few years ago. Part of his problem was that he had fairly flat feet, and that's a common scenario with children in this 11 to 12 age group when they get Sever. So Dom, can you just show us how you do your calf stretches? So starting off with the straight leg one, hands against the wall, leg back, and then lunging forward and holding that for about 20 seconds. You should feel a pull in the top part of the calf up close to the knee. Okay, so that's the first one. And if Dom comes back and then he brings that back foot forward a little bit, and then he does a bent knee calf stretch. So this stretches a bit deeper down near the Achilles and gives some good flexibility through those calf muscles, which are often tight. Okay, that's great, Dom. Thanks for the stretches. Now we're going to show you an exercise that we also had Dom doing to work on the control of his muscles through his calf. So you're going to rise up onto your toes, Dom. So up you go, and then lower back down again. And I want you to do that 10 times, a little bit faster than that. So rise up and lower down, and do that 10 times. Good, that's 3, 4, 5. And it's important to just really focus on the lowering component, because if that heel slams down into the ground, that also makes it painful, but it's more the ability to control the calf through the range. Thanks, Dom. So that's a little bit about the way that we manage children that have Sever's disease or Sever's condition. Sever doesn't mean that you're going to cut the tendon. It's basically the name of the man that identified it as a common thing in children that are adolescent age. So hope that can help. If you've got children with heel pain, it's possible that that's part of their condition. As I said, flat feet can be a real contributor to it too. So children with flat feet often need to do some work to strengthen their foot. In the worst case scenario, they may need some orthotics or better footwear. Really stable shoes rather than really flexible shoes help as well. And that's something that we can identify and help you to manage. Have a great day.